What causes that hardening of the arteries that you talked about? What lifestyle changes? Because we'll talk about cholesterol. I have talked about it personally because of my own cholesterol on this show. But what causes the hardening? I think a lot of people don't know about that.
So, it typically is multifactorial. We'll see that in terms of the calcification of arteries that begins to happen. It can happen from persistent high blood pressure that's there, and that's protracted, cholesterol too as well, diabetes. And so without getting too technical and scientific, all these processes work to have a combined impact on the vessel wall that also lead to hardening, but also lead to this obstruction that can occur.
Okay.
Now,
And smoking and sugar do that too, specifically hardening, right?
correct. So sugar plays a role as far as in heart disease. Now, specifically to which pathway, we know that increased sugar consumption, especially added sugar, increased cardiovascular mortality or death. That's there. We know that there is an association that's there. There's several pathways that have been worked out as it relates to its increase in triglycerides and some of the fats in your system from excessive amounts. We know its role that it can play with diabetes too as well, not as a primary driver, but as a subsequent driver too as well. And all these things kind of work through a synergistic process that can impact the vessels. Now, the one thing that is scary, but also important to understand is most people, and if I were to ask you, would you say a heart attack is more likely to happen from an artery that's blocked 90%, 70%, or 40%? Which would you say?
Well, I know the answer because I did research and I was going to ask you about stents. So, and I was reading Dr. Michael Greger. So he said 50%, I think. Is that right?
The areas that are not obstructive, that we otherwise wouldn't do anything about, areas that are 20, 30, 40, 50% are the areas that are more likely to result in heart attacks than what we colloquially think, 70, 80, 90%. I have patients all the time saying, Doc, it was a heart attack waiting to happen. I said, no, not necessarily, right? It's the other areas. Now you say, well, why is that?
Yeah, why is that? That's totally counterintuitive.
Yeah, so what ends up happening, I'll tell you first the answer, and then I'll give you the analogy if it doesn't quite make sense. It's the fact that when it's chronically building over time, slowly but progressively building, it's like a mound that's there, and that mound gets a thick cap. It's very hard, and it just continually increases, as opposed to think of it like a pimple area for like a small kid and so forth that's there, a young child. And so these little pimples, well, they can be fragile. They can get irritated really easily. And if they get exposed and they pop, like, the kids, then what happens? The content comes out. So in the artery, you have these pimple bump-like areas that are not very occlusive, but if they're fragile, get irritated, they release their contents, which is like a pustular type of content that's inflamed. Your body goes into overdrive to heal that area with clot formation. And that will lead to obstruction of the vessel. And that's more likely to happen than one that's built up very slowly and with a thick cap over time.
Okay. So, and is that the pus analogy, is that cholesterol? What is that?
Yes,
Okay.
that's a mixture of all the inflammatory cytokines that then lead to the cholesterol. They meld the cholesterol and lead to atherosclerosis. Yes.